Hi, this is Paul Sakis, Good News Planet, speaking to Dr. Jeffrey Applebaum. Hi, doctor. How are you?
Good morning. Hello.
You're a family practitioner, sees Alzheimer's patients, assistant clinical professor, family medicine, the University of California in Davis. We're going to talk about Alzheimer's and become defining disease of baby boomers as the first wave turned 65 this year. And there's been recently an annual Alzheimer's Association facts and figures report. So, doctor, thank you for coming on to Good News, a very important concern. Hopefully one day will be eradicated. But tell us about the Alzheimer's Association and this new annual report.
The report has just come out, and with lots of facts and figures, but the most dramatic is the fact with the 70 million baby boomers now starting to become 65, we're going to be facing a tsunami of new people and patients that develop Alzheimer's. Currently, 1 in 8 people above the age of 65 have Alzheimer's disease. And what we're looking at, 5.4 million people currently, becoming as many as 16 million by the year 2050. But beyond the patients themselves, we have the family caregivers. And there's another 15 million that currently are going to triple as the number of patients increase, because these caregivers are intimately associated on a daily basis. 80% are unpaid, they're family and friends. This is separate from all of the other formal sources that provide care. And caregivers themselves are at significant risk of developing major depressive disorder or major illness in the first year. 50% will develop a major depressive disorder or illness. So it has a major impact ahead, as well as financially for our society.
What is Alzheimer's disease?
Well, Alzheimer's is a combination of clustering of different symptoms and findings. The disease itself looks like at this point caused by certain proteins in the brain and certain abnormal proteins within the cells that cause damage to neurons in specific areas of the brain that spreads over time. And the clinical picture looks like initially dementia, memory loss, problems with focus and concentration, significant impairment that progresses over time to include inability to learn new tasks, to remember words, tends to repeat the same questions, stories over and over, inability then to function in terms of writing checks, driving a car, cooking, turning off a stove, a faucet. There's a lot that has to do with our memory, but beyond that, in the disease process, since other areas of the brain are also affected, we're looking at problems getting dressed, picking out our own clothing, even problems with incontinence, controlling our bowels and bladder. We have problems with speaking and eventually can become mute, and even difficulty getting out of bed. So this is a condition that affects our entire brain and body beyond cognition and memory alone. The condition is actually diagnosed by autopsy, but we can cluster these symptoms and progression of disease, and that's what's known as Alzheimer's disease, named after Alois Alzheimer, who initially made the diagnosis on a patient of his.
So I heard you mention that you actually discover it in autopsy because you can see that the brain is what? Is that how they can tell something to know it really is an Alzheimer concern?
Yes. When you look at the pathology, the brain is actually shrunken in size, a considerable loss of volume of the brain, and especially in certain areas that deal with focus, concentration, and memory. And then when you look microscopically, you see these plaques. It's like a sticky bubble gum in the brain that will not be cleared. So it sits between cells. Then you look at the cells themselves, and they're swollen and damaged. So this is a progression of a disease process that occurs anywhere from a few years up to 22 years.
Can you see these things with the well?
We're starting to see with certain types of scans, and they have to be special type of scan that has sometimes a radionuclear type of material that attaches to the amyloid. The normal PET scan you can't. You do see with a PET scan, though, in the areas of the brain that should light up because we're using our brain for cognition, the areas suddenly go dark. They are not as active. So the brain function literally shuts down over time as the disease progresses.
Are there some, one, I guess, so that's sort of a little bit about diagnosis. How about treatment? Do we have treatment?
Good question.
Options?
The treatment comes in a number of different forms. When patients see their physicians, patients, if they have true dementia, and again, we want to make sure that they have dementia, because if they don't, there are many treatable conditions that are non-dementia that will often resolve in terms of all the symptoms. But with true dementia, we have medications that, assuming, again, always some risk with medicines, but a lot of benefit as well. Early dementia is treated with a medication that helps the brain function better. Aricept or donepezil, 5 and 10 milligram, has been a good key type of medication that helps one of our neurotransmitters, acetylcholine, work better in the brain and allow us formation of memories. And as the disease progresses into the moderate or severe, a medication that works in a different way is also very helpful to add on. And we have 2 different medications for the moderate to severe, the donepezil 5 and 10 along with Namenda. And these 2 with different ways of working can often help with the progression of symptoms and control some of the types of cognitive and behavioral symptoms that occur. So we have that along with other teaching areas for caregivers and patients, helping them be stable, helping prevent falls and syncopal episodes or passing out, helping prevent the other conditions that go with this. Because as we age, we normally have multiple other medical problems, and if somebody has Alzheimer's disease, whatever other medical problem they have is twice as hard to treat and control because the person cannot contribute to their own health. So finding out what the other conditions are and treating those aggressively to prevent disease, often leading to heart attack and especially stroke. Stroke is very common in Alzheimer's patients because of the effect of this plaque on blood vessels in the brain. So it's a multitude of pathology and symptoms that we see, and the physicians often will need to sort that out. If it gets complex, a primary care physician can then send somebody to a specialist such as a neurologist or a gerontologist who deals with the older population. So we've got lots of access. What we need is people to be aware so that they bring in their loved ones as early as feasible.
So how does attitude and state of mind and a good sense of humor, does that fit in anywhere?
Absolutely does. When people embrace life and enjoy it, feel good, are not depressed, when they're exercising and eating well, learning new things, that plays a very big role. If we stress our brain in negative ways, we push our overall health and increase our risk of Alzheimer's. But when we enjoy life and when we're learning new things, our brain actually does better. And so I get people to try to do puzzles and crossword puzzles, for example, learn a new musical instrument, learn a new language. If you're right-handed, occasionally write with your left hand. Learn new challenging things that are not automatic because the brain likes it. And that's a big factor, and to enjoy life. Very
good.
quick.
I like to hear that.
Yeah.
I like to hear that. Is there a common point of, in addition to, the enjoy life, the acceptance of this, disease? Does someone actually come to terms? Is that sort of in that way at all? I've come to terms that I have Alzheimer's. I might not remember, my own grandkids' names.
It's very frustrating, and very often the people that actually have Alzheimer's who are struggling very, very early on can recognize that they're changing, their memory is failing, they can't do the things they want to very early. But as this progresses, the unfortunate part is that people don't recognize and realize what they're going through. So as the brain function deteriorates, their memory for life and the future falls apart. One of the things that I often tell people is that memory is as much about the future as it is about the past. We think of memory being past, but our past events, true, are held in memory. But think about for a moment our lives in the future, everything that you plan on doing today, tomorrow, next week, month, and year, when you retire, what you're going to do for a holiday. All of this information is anticipated because we can't foretell the future, and all of that anticipated memory is held, that anticipated future is held in memory. As a result, if you lose memory, you're losing your future and your present. That's what goes first. So that's the difficult part. It's not the past that disappears. That goes last because we have a small area in our brain that needs to work very well called the hippocampus, and that area brings in new information and consolidates that for long-term memory. It's a small area, and when that is diseased, as it is in Alzheimer's, cognition and memory start to decline very rapidly.
The brain is amazing. I had the good fortune to work on the Brain series on PBS for a few years when I was in Channel 13.
It's amazing. There's no end to this.
It runs there. You can't climb it. We started off with Greg Louganis jumping off the diving board. You can't walk up the steps and jump off the diving board without the brain, right?
Yes, exactly. Everything that we think, our thoughts, our emotions, in fact, the emotional side and the rational side of us are all tied together, and you need both sides, both aspects, the emotional and the rational side, to really have good logical reasoning. You can't take away the emotional side. So we need to preserve all of that.
Mm-hmm. Doctor, is there any brain food?
I would say foods that good vegetables, fresh vegetables and fruit, and salads, good fiber. The vitamins per se are not, because you need the vitamins basically in the natural form. We use fish oil, 1 or 2 grams a day. Protein, these are all parts of a good balanced diet. So there's not one particular food that you can take or medication or supplement. It's really an overall style.
So two more quick questions here. Tips for caring for a loved one. What is the difficult job? And as you stated earlier, potentially you might get depressed.
Yes.
What are some tips that a good caregiver should know?
Initially, get involved with others. Do not be isolated, because this can be isolating as you give up your own disease as the person gets worse, and that makes you less effective. So get other family members and friends involved. Support groups. There's a respite group so you have some breaks for yourself. There's a website, the www.alz.org, and that website could give other clues. There are usually support groups locally. For people that wander, for example, a doorknob is a cue to us to open the door to get out. And for an Alzheimer patient, they may remember the clue to use the doorknob to turn and then leave the house and wander but not remember how to get back. Just simply putting a large sock or a cap over that doorknob and taping it on takes away that visual cue. There's lots of different aspects of care, making sure that you don't have the patient able to turn on a stove or a faucet and then walk away. I have patients that have burned down their own homes or flooded their homes. So you have to look at caution. You have to prepare the house to prevent falls, injuries, avoid ladders, throw rugs, make sure that the bathroom is safe, that there's areas to hold on to. They should not have a step-in tub. So there's so many factors to providing safety and a safe home to prevent injury, and then getting adequate care from your physician or physician extender. There's lots of access. We need
Sounds it. A lot of good news, a lot of things to do, to be aware of, and to make it a healthier situation.
You've asked the right questions, because this interview right now, we've given a lot more for the caregivers than I have in the past, because you asked the right questions here, and that's really critical. And there's a book, The Memory Bible, also to help people prevent some of the ravages, and by Dr. Gary Small out of UCLA. And that Memory Bible has been very helpful for people to help provide strength for the brain.
Mm-hmm. Well, it's a very important I just put up right before we spoke something on SeniorNet, which is an organization I'm on the board of, and teaching seniors how to use computers. Another outreach of good ways to keep your brain on the move.
Everything that we can do to strengthen and novelty our brain likes. It's an organ of prediction, and if we don't use it, it does fail.
Well, you're well spoken with the subject. Last question, what's good news for you, Doctor?
The good news today is that I've been given the opportunity to reach out to close to 3 million viewers, or actually people that can get information and hear this or see this on the Internet. And this is wonderful because my desire is to get this type of information out so that people don't have to suffer. So many people find out they have the disease already at the moderate stage. So that early diagnosis, early knowledge, being vigilant with your family, that's the news that if I can pass on to others, makes me very happy.
Very good. Well, that's wonderful. Thank you very much. Very thorough, very detailed, and very helpful. So thank you very much, Dr. Applebaum.
Kind, and thank you. My pleasure.